Good morning to the peace-loving people of Liberia, and good morning to our viewers. We are very happy and honored to be back on another edition of Health Talk. The Mama Lume Health Talk platform is a 1-hour program that discusses a wide range of health-related issues. It brings you face-to-face with health professionals and provides you with causes, signs and symptoms, complications, and preventions of diseases and illnesses affecting us in our respective communities. Our aim is to promote and maintain proper health care in our society. On today's editions of the show, we will be discussing TB or tuberculosis. Yesterday was World TB Day. March 24th every year is set aside as World TB Day. And the theme for this year is "The Clock is Ticking." The theme has been chosen as it conveys the sense that the world is running out of time to act on their commitment to end TB. TB remains the greatest killing disease in sub-Saharan Africa. Liberia is within the 30 countries with the highest tested for drugs resistance. TB combines the current coronavirus pandemic, and so the important question facing us today is, how can we ease the burden of TB? In other words, how can we prevent the transmissions? And how can we improve the treatment for those currently affected by TB? Well, this is the subject for today's presentation. It is difficult to control the spread of the XDR-TB because patients default on their prescribed treatment. That's the word from doctors at various treatment units. The extremely drugs-resistant strain of TB is the most prevalent in the prevalence of most patients battling with the stigma attached to the drugs. To discuss this all-important topic, we have with us in studio Mr. Jabo T. Doyen. Mr. Doyen is a physician assistant with a bachelor's degree in health sciences. He has a lot of clinical experience in health setting. And also we have Ms. Muna M. Dix, OIC of JFK Chest Clinic. She holds a Bachelor of Science degree in nursing, and she's presently doing her master at Cottington University, reading epidemiology. To be part of the discussion, the numbers to call is 0770-107-107, 0886-107-107. You can call and share your experience with us, or you can call and ask our studio guests any questions you want to know about TB. Do not forget to follow our Facebook page, Mama Lume Health Talk Platform. Please do subscribe to our YouTube channel, Mama Lume Health Talk Platform. So sit back, relax, and listen to this educated health talk coming to you just after a short break. I am Mama Lume, and this is Health Talk.
Begin at tunesliberia.com.
We are Project Liberia, Mama Liberia. Must all rise, stand together to fight Corona.
Welcome back to today's edition of Health Talk. Welcome back to today's edition of Health Talk. As you're listening to my introduction, today we are discussing TB or tuberculosis. And yesterday was World TB Day. So I have with me in studio Mr. Doyan. Mr. Doyan, welcome again to Health Talk.
Thank you so much.
And next to him is Miss D, the OIC of JNK for chest cleaning. Welcome to Health Talk.
Thank you so much.
So, they say ladies before gentlemen. So, so I'm going to start with you, Miss D. Today we are talking about tuberculosis, right? So let's start with the basics because we normally hear people saying TB, tuberculosis. Like most people actually doesn't know what it is. So when we talk about TB, what is TB?
Firstly, we say TB is a disease that is caused by a bacteria called the Mycobacterium tuberculosis. It affects everyone. TB has the signs of symptoms, especially when it comes to the active TB. It first day present with cough of 2 weeks or more, and then followed by poor appetite, sweat at night, weight loss, and breathing difficulties.
Okay, so we will come to the signs and symptoms. We just need to know what causes that infectious disease. Like you told or you say most of the time it can affect the lungs, right?
Yeah.
Yes, it affect the lung too. It affect other organs of the body
as
too,
well.
right?
Yeah.
So, Mr. Doyan,
Sure.
what are the various type of TB? Because you were talking about active phase. So, what are the various type of TB?
Actually, we have 2 types, which is the pulmonary tuberculosis and the extrapulmonary tuberculosis.
Okay.
Sure.
So can you just give detail a bit the difference between a pulmonary and extrapulmonary, or you want her to help you in?
Okay. So for the pulmonary tuberculosis, is one of the types in which it only affects the lungs. And in so doing, the patient will normally experience severe chest pain. Because by then, we see what certain patients will have a good immune system that it may not go extra miles. So
Okay.
it is possible you have the extra the pulmonary tuberculosis and you can be cured from that. But for the extrapulmonary tuberculosis, meaning it have overcome the lungs. It have gone extra miles by going to other parts of the body.
Okay.
Yeah, so whether it would be the bone or other part of the immune system, that will be referred to as extrapulmonary tuberculosis. Normally in the pulmonary tuberculosis, when the patient is in an active phase, they can spread from one person to another. Alright. Unlike the extrapulmonary tuberculosis, which research have proven that it is difficult.
Okay.
Yeah. And sometimes in the pulmonary tuberculosis, patient will always be complaining about coughing and sometimes coughing out blood. Unlike the extrapulmonary tuberculosis, where the patient may not have that history of coughing or even coughing out blood.
With blood. Okay.
Yeah.
Thank you so much.
And most common in children.
Okay. So Miss Diz, we normally hear about the TDR TB, the total drugs resistant TB. Does this thing really exist? Because you work at a chest clinic. Do it really exist?
Yes.
Okay, can you
The drug-resistant TB exists.
Okay.
Especially people who come down with a drug-resistant TB are people who were exposed to the drug before. Like take for instance, you came down with the bacteria and then you were treated, completed your treatment, or you lost in the treatment. And when we say lost, it's like you have taken the treatment for 4 weeks or more and you broke away.
Then you default.
You defaulted, yes.
Yeah.
So at the end of the day, you have already been exposed to the drug. So there's a possibility that you build resistance to either rifampicin or isoniazid, because it's a combined therapy, and these two drugs people quick to bear resistance to them. But other people will ask, but having taken TB medication before, why have I come down with resistant TB? But you have to take the medication before you come down. Some of them don't know when they go to the drugstore, when they start coughing, they get to the drugstore, they buy some drugs that contain rifampicin. And when they take these drugs, they are already, or they were already exposed to the drug. So when they come down with the TB, and we do the gene expert, because the gene expert test that is able to tell us, show us the resistant TB patients. And then if the rifampicin is detected, these are people that we send at TB Annex for treatment.
So you work at this setting, especially at JFK, because I know JFK have one of their branch from TB Annex, right? Because
Yes.
I do remember my clinical setting, sometimes we used to send patients to JFK, sometimes JFK to send patients to TB Annex, right? So you, as an OIC working at the chest clinic, how common is TB in Liberia?
Right now, as I speak to you, TB is on the increase in Liberia. Especially for some communities, depending on the risk factors. We got a lot of cases coming from some communities, maybe that may not call.
Yeah.
We have many cases coming. Sometimes a day, in a daytime, we have about 5 bacteriologically confirmed patients. That is patients who are presenting with cough, and we did the other AFB or gene expert and it came positive. We have about 5 patients a day.
So now go back to Mr. Doyen. Mr. Doyen, we often hear that tuberculosis and HIV and AIDS infection are somehow like brothers and sisters, because they're almost like working together. So what's the relationship between tuberculosis and that of HIV infection?
Okay, thank you for the question. Tuberculosis, as we all know, it affects the primary organ it affects is the lungs. Granted, and we all know the lungs also is part of the immune system. All right, and HIV, the primary goal of HIV that you achieve in the human body is to attack the immune system. And every human, as we all know, that we have a type of cell within the immune system that we call the CD4 count, and almost like the giant for everybody.
Sure.
So, if you do a statistic, you'll notice that patient coming down with HIV and on their treatment, it helps them. They stand a better chance of preventing TB, but it's not in the case of TB.
So
TB,
all TB patient, HIV patient, or all HIV patient, TB patient?
No, what I'm trying to say,
Okay.
all HIV patients, they are not prone to TB.
Okay.
All right, they are not prone to TB, but there's a risk factor. Because if you do your risk factor analysis for TB patient, you notice that of the risk factors, like the age, those that are smoking, but HIV patient stand a greater risk of having TB. HIV patient. So if every patient who has HIV, you stand a greater risk of having TB because of the pathology that is involved, the links are involved with TB and HIV. So if any patient who have HIV, which of course we don't discriminate our patients out there, we will advise you, your medication should be a priority, because the probability of you coming down with the bacterial infection that affect the lungs is common for you. Yeah.
Okay, thank you so much. Thank you for that clarity. So now go back to Misty. Misty,
Yeah.
You know you're in the setting, and so like most of the question will be like around the setting, clinical setting.
Yeah.
So when it comes to the signs and symptoms, okay, before we move to the signs and symptoms, when it comes to the challenges facing, to get drugs, to patient in Liberia really have access to drugs for TB? Are the drugs available?
I would say yes. Presently,
Are they corresponding?
the patients, some may correspond and then others are not corresponding.
Okay.
But drugs are presently in the country.
Okay.
Maybe
For
we had
TB.
shortage before, but for now, we have drugs in the country.
So you were talking about signs and symptoms, right?
Yeah.
So how can we detect the symptom of TB? How can one detect the symptom of TB?
As my colleague said, we have the extrapulmonary TB and the pulmonary TB. And the pulmonary TB is the active TB. So the signs and symptoms for the pulmonary TB, the first signs and symptom is cough of 2 weeks or more. So if the person is coughing 2 weeks or more, it's a symptom. Night sweat, sweating at night, poor appetite, weight loss, chest pain, breathing difficulties. These are the symptoms of the pulmonary TB. Then when it comes to the extrapulmonary TB, it depends on the organs that is affected. Take for instance, if it affects the brain, which is the layer of the brain, the meninges, the person will show symptoms of meningeal problem, where there will be some contractions of muscles and what have you. The nerves will be affected. If it attacks the lymph nodes will be inflamed, and you can see that. The lymph nodes will be inflamed. If it attacks the bone or the spine, you will notice that the person will feel bone pain or pain in the spine. Also, it attacks the abdomen as well. And it will feel pain or swelling, and that there will be a mass at that site. So these are the signs and symptoms when it comes to tuberculosis.
Okay, thank you so much for that vivid clarification. So to be part of the discussions, the numbers to call is 0770-107-107, 0886-107-107. So you can call and ask the guest panelists any questions you want to know about TB. You can also call and share your experience. Maybe you have been diagnosed with TB before. What are some of the challenges you face? So you can call and be part of the discussion. Good morning, your name and where are you calling from?
Morning.
Good morning, your name and where are you calling from?
Morning, my name is Carlo calling on 12th Street.
Yeah, Carlo, welcome to Health Talk.
Yeah, I want to know something about TB. About so when you cough, 2-3 weeks when you go after that, and then you stop coughing. But before they can start, you vomit with blood, but then the blood follow for that 2 weeks. And then you start taking water, more water, again, keep yourself, but then no matter the body helping you. So it shows that part of TB or not.
You got a question?
Yeah, sure.
Yeah.
Okay.
I got a question.
All right. Keep listening to Health Talk. We discuss that, yeah?
All right.
Okay. You want to address a question?
Yeah. So he asked a brilliant question, and to recap what the question is, it is possible I was coughing for maybe 1 or 2 weeks. Yeah, even I coughed with blood. And suddenly it stopped.
It's not.
Yeah, it's possible. Probably, I went to the drugstore and took over-the-counter medication. Like my sister said, that it's possible that I took rifampicin. Let me get a clear scenario. When I was doing my senior courses, I used to go to Cloud Health Center to do, volunteer work there. So in my community, people used to come to me, to give some, medical advice. So the brother came to me. He's a Nigerian guy. He's the best friend of mine. So he told me, "Oh, baby, I'm coughing a day." I said, "What I think he can go to the clinic." But after 2 days, I noticed that the guy was taking rifampicin. Yeah. I said, but then I was still a student. So I said, "But this medication is for TB." So I asked him, "But why were you diagnosed?" He said, "No, I didn't go to the clinic. One of my friends who worked, into the clinic told me that I should take the medication." So it's possible within if you take it for maybe 1 or 2 days or 1 or 2 weeks, it will stop. But that does not mean that you are free from TB. Because we said at a certain point TB is asymptomatic. Meaning You have the signs, symptoms, everything that we talk about.
You can get it, but you will not present any signs and symptoms.
Sure.
Yeah, but it's within the system, so you have to do that follow checkup or go to the hospital
Very
and
good.
make sure. And once you have that persistent cough, like you coughing, it can come up, right?
Yeah.
You have to go to the hospital. And I do believe the test is for free, right?
Yes.
The test is for free.
Everything is for free.
Yeah, it's for free. The medication is for free. So, like, you have to go to the hospital and see how best to do a proper checking. Don't just listen to people. Don't just diagnose yourself without any follow medical checkup.
And let me come in to what he said. Because if you look at coughing out with blood, there's a possibility it is not TB or it's TB. Because there are other bacterial infections that will cause a person to cough out blood. So definitely the only way we can know that it's TB if you come for testing. Yes, so it will be better when you notice yourself coughing out with blood, you come to the hospital and we do the test. There are a lot of cases that we have sputum with blood staying in it and it was negative. And we send them for treatment with other antibiotics and they got well.
So, if you're listening to this show, the numbers to call and be part of the discussion is 0770 107 107, 0886 107 107. Call and share your idea, call and ask any questions, anything you want to know about TB. Today our focus point is on tuberculosis. So call and ask questions, ask our studio guests whatsoever you want to know about tuberculosis. Good morning, your name and where are you calling from? Okay. Good morning, your name and where are you calling from? Your name and where are you calling from? Okay. So you can keep your call coming 0770 107 107, 0886 107 107. Call and share your experience. Call and ask our studio guests any questions you want to know about TB. Good morning, your name and where are you calling from? Can you please leave your monitor, please? Yeah, your name and where are you calling from?
My name is Papa Jerry.
Yeah, couple, welcome to Health Talk.
Yeah.
Please leave the radio. I'm getting the feedback. Please leave the radio.
Sorry,
Yeah, we're discussing TB.
yeah, I want to know the difference. So in case you get coughing, and you don't see no blood, but the cough get hotel baby you have time.
All right, thank you so much. Keep listening to the show, yeah? All right, so couple said, okay, the numbers to call is 0770 107 107, 0886 107 107. So couple is saying that in case you are just coughing, persistent cough, and you're not coughing with blood. So what can we do?
Yes, like we said from the beginning, is the first sign of pulmonary
We
TB.
gotta call them.
Hello?
Good morning, your name. Where are you calling from?
Yeah, I'm calling from Front Street. My name is Ezekiel Yuba.
Fika Yuba, welcome to Health Talk.
Yeah, my question is what is the cause of tuberculosis, TB? What is the main cause?
All right, we discuss it. Keep listening to Health Talk, yeah?
Yeah.
Good morning, your name and where are you calling from? Good morning, your name and where are you calling from?
Good morning, Mr. Thompson. I'm calling from Logantown.
Yeah, Mr. Thompson, welcome to Health Talk.
Yeah, I had problem before, but the people told me that I right there from here already, but then I can still experience pain in my waist and pain in my knee that I cannot squat down for long. Then besides that, I breathe. I always breathe inside, like more especially like when I climb in small hill. I will be breathing. So I don't know. And they told me that I already graduated. They gave me the 6 months. I took all the medication. Regularly, I retention hospital. I took all of the tablets and they been giving me.
Alright. Keep listening to Health Talk. Our guest will discuss that.
Okay, Mama.
Thank you so much for calling.
Okay.
So the first caller said, what is the cause? Okay, first the lady said if you're coughing persistently and you're not coughing with blood. We got a call. Good morning, your name and where are you calling from?
Good morning, Mother. I'm Mr. Devo.
Mr. Debo, welcome to Health Talk.
Yeah. My question has to do with if someone has TB, you can exchange with some of the call phone, and then the exchange.
Alright, keep listening to Health Talk. We'll address that, yeah?
Thank you.
Good morning, your name and welcome to Health Talk.
I want to know, Victor.
Yeah, Vita.
Victor, can calling.
Yeah, Vita, welcome to Health Talk.
I just smoking the jar and put send it people in there. I just smoking the jar.
Alright, we'll address that. Good morning, your name and where are you calling from?
I'm calling from. Yes, I'm here.
Your name?
I'm calling from here.
Robert, welcome to Health Talk.
Yeah, you're discussing our TV.
Yeah.
Yeah, some people say the people stomach constantly.
Mm-hmm.
Yeah, keeping your stomach, you cough, line on it.
So what's your question?
Yeah, I'll give you a point of that.
Alright, thank you so much. Keep listening to it after we discuss that, yeah? So we're talking about TB today, and this is it's really common in our setting, so we expect a lot of calls that people will want to know because people are down with this condition. Yeah, now address the lady address her questions where she was saying persistent cough. For me, I would have asked her to go to the hospital and do
Yes, yeah. Like I was saying, the first sign of tuberculosis is persistent cough of 2 weeks or more. So if you are coughing persistently, though there is no blood, well, you have to go to the hospital to do a testing. The only thing that can make you to know that you have pulmonary TB is the test. And not all pulmonary TB patients cough out blood. That's what I want her to know. So let her try to get
So please
to
go
the
to the
hospital.
hospital. You go to JFK, you can go to TBNS, you can go to Redemption with free of charge. You will not pay money. So Mr. Doyan, can you answer? Good morning, your name and where are you calling from?
Yeah, I'm Ezekiel again. Ezekiel Iba.
Ezekiel, welcome to Health Talk.
My other question is that why is it that when you go to the hospital, the people always demanding for chronic cough? And you understand? If we find chronic cough, they can say you not get nothing. You know what I'm saying? Anytime you go to the hospital, and when in case I'm coughing and I'm seeing blood, but in front of them, it's not happening. But they can demand for chronic cough. When you post straight down and say you get TB going, you know what I'm saying? This is what they are doing to the hospital, all the hospitals.
All right, thank you so much for your concern. We'll address that, yeah?
Thank you.
So, Mr. Doyan, let's address the next caller. He said, what is the cause of TB? What actually causing the TB?
Okay. The major thing that causes TB is a bacteria we call the Mycobacterial tuberculosis. For example, the same way you got coronavirus, right? What causes coronavirus is the COVID-19 virus. Yeah. So it's the same way. For example, we have
it's a long-chain virus from the coronavirus diseases. Yes.
Okay, so it's the same way when, for example, say what causes malaria. So nothing else causes TB with the exception of that bacteria. Yeah.
Okay. So the other caller was saying he experienced pain in his knee, in his stomach, like he already gone through the 6-month treatment, then take all of his medication on time, and he graduated, but still he's still feeling the signs and symptoms of pain.
Yeah, like I was saying, TB can reoccur, we call it relapse. I heard he's talking about 6 months. Because if there are pulmonary cases and some other extra pulmonary cases, we treat them for 6 months. But when it comes to the spine, the bone, and the brain, we treat it for 12 months. So since he says 6 months and then he complaining about back, so I'm not really understanding better. But all the same, if you have come down with TB before and you noticing another symptom, all you can do, go to the hospital, especially when it comes to
Go back to
go back to the hospital, especially when it comes to pain in the bone, back.
Good morning, your name and where are you calling from?
Yeah, good morning. This is Sponsor Balanceo. Yeah, Queen. I just want to know whether I have anything with the number here.
Come again?
I say I'm calling from Balanceo. Is this half answer radio station?
Sure, you're speaking with Half Earthen Radio Station, but we are on Health Talk Edition.
Okay, thank you. I just want to store the number because you have certain program called Crown Wash.
So, our time we have to go through. So once you get the number, she can call. So we deal with time. So another person was saying that if one's have TV, right?
Yeah.
Can you share cup, spoon, plate with the person?
Okay. Yes, I will say yes. Because the first thing, extra pulmonary TB doesn't spread from one person to the next. Pulmonary TB is not in the spit, it's in the lungs. So the person have to cough it out or sneeze it out. So if you cough, that's when you go to the hospital, we get you cough it out. When you put in spit, we'll not take the spit because the TB is not in the spit.
And one of the
Yes,
fellow
one of
was
the
just
fellow was
complaining
yes.
that when you go, but my brother, when they say you don't have TB, you should be
Yeah, you should be
grateful.
happy.
Because he said like when they call, they can say go for chronic cough. Like seriously? So you have to get the chronic. When you put the call, they can say no, they wanna get TB, go for chronic. So you really need to adjust that for you.
Yes, so like if you have a patient or relative member of yours that is positive with TB, you can share spoon, you can share cup, you can share plate with the person. But the only thing is they should be watched. Because even a person who doesn't have TB,
Only two types of TB, the active and that of the
the
pulmonary.
pulmonary. But for the extra pulmonary, I said that it doesn't spread. So you can share cup and spoon, now it's nothing.
So how
But
will you
people-
know the difference?
We said the difference. We said for active TB, the person cough.
So in case the person go to the hospital, they don't explain it to them.
No, we give health talk at the hospital every morning. We give health
The
talk.
relatives, the family members, everybody is still
Everybody, we give health talk to everyone before we start dealing with patients.
there. So it's advisable to use the same spoon, cups.
Yes, but the only thing is should be watched. Do not isolate the person. The most important thing when it comes to the extra, the pulmonary TB.
Good morning, your name and where are you calling from?
Yeah, I'm still Ezekiel. Why is it that I'm calling? Is my brother here? He's saying he took the treatment, 6-month treatment, and now he's still vomiting blood from his stomach. He's vomiting blood from his stomach. That one I'm asking for.
Ezekiel, he need to go back to the hospital, please. Can you carry him back to JFK or TBNS, please?
TB honest, yes.
Yeah, carry him back immediately because he is not killed yet. He need to go back for further checkup because they got complications. Probably a complication have occurred, so you can carry him back for further checkup.
Okay.
Thank you.
very much.
Okay. So you were saying something. We'll soon be out of time.
Yeah, I was saying when it comes to the extra pulmonary, it doesn't spread. So you can use cup, you use spoon together. But when the pulmonary cases, we say the first time will be cough. So definitely it's a concern. People are concerned
Good
that the
morning,
person
your
is
name and where are you
coughing.
calling from?
My name is Dixon Cocker, calling from Flying City of Management and Technology.
Yeah, Mr.
thank
Kofa,
you.
welcome to Health Talk.
Yeah, okay, thank you, Mama. Thank you for the platform and thank you for your guest. Yeah, the time that you put it into inform our public and we made the platform be information that others can benefit from.
Thank
Thank
you.
you ever so much for the effort.
Thank you so much. Thank you for your motivation to and your support. Thank you.
Yeah, okay.
So, yeah, let's keep the ball rolling.
So you can share spoon. The person should wash the spoon. That's the most important thing.
Okay.
Yeah.
So now look at the transmission and vulnerability, right?
Yeah.
Let me take the call. Good morning, your name and where are you calling from?
Hello?
Good morning, your name and where are you calling from? So let us look at the transmission and vulnerability. Mr. Doyen, how is TB transmitted?
TB is transmitted from person to person. For example,
Let me take the call.
okay.
Good morning, your name and where are you calling from?
My question is just a general again. She talked about you can spread. The one that can spread, how will you know the one that can spread, the one that can spread?
All right, thank you so much. Thank you so much for addressing. Good morning, your name and where are you calling from?
This is Shedema Stephen calling from Conway.
Suleiman, welcome to After.
Yeah, but I said one time I want you to come this house.
Come again?
I said one time I want a friend who come this house. Yeah,
Whenever a pregnant woman do what?
get the virus.
Virus about it.
And they didn't take their drugs or they didn't go to the hospital. When the child was in the stomach, received that virus also.
The bacteria. So he's talking. You talking about TB or you talking about HIV? Which one?
I talk about TB, HIV also. Both people.
All right. Thank you so much. Keep listening to After we address that.
Okay.
So he's saying when a pregnant woman have this bacteria, the TB bacteria, or maybe the HIV virus, and they defer their treatment or they're not taking treatment at all, will the child be, the fetus be affected with the virus?
When it comes to HIV, I would say yes. The fetus will be affected because it can be transmitted through blood. So if you're not on a medication to suppress the viral load, the fetus will be affected. But for
but the HIV, the fetus will be affected
Yeah.
in maybe when there is delivery, it's not properly managed.
Yeah.
Right?
yeah,
Okay. What's
And
about
then
the TB?
the TB, the fetus will not be affected because you're not coughing it for it to spread to the patient should inhale it and it goes to the lungs. But the child is within the uterus,
The uterus.
and you cannot cough for the child to receive the especially when it comes to the pulmonary.
Okay, that was a brilliant answer. I hope we answer your questions. So, Mr. Doyen, can we talk about the transmission? Because we're already out of time.
Yeah, like I said, TB is transmitted from person to person, and being it works in the air. Droplets of air bubbles bleeding. For example, if I have TB and I'm in the active phase, if I cough, it's possible that the person that sits near me will have the bacteria. If I sneeze, or even if I'm sinking, so it's possible that I use my hand, upon sneezing, I use my two hands. Oh, I'm covering my nose. Which of course is not ethical to just sneeze use my two palms to sneeze. I may shake that person's hand, and the person may maybe receive food, put it directly in their mouth to also come down with the virus and the bacteria. Sorry.
Okay.
The reason is that research have proven that whenever I sneeze, it's possible that up to 440,000 of those droplets are spread right away.
Of course, yeah.
There's a reason it's always easier for somebody to get it through sneezing and coughing or sinking.
Okay, but most of the time when we see or we hear people using their hands or their elbow or sometimes handkerchief, right? When they are coughing. So through this means, which one can be the fastest transmission means?
Okay. ethically or from a medical perspective, even though it's not 100%, you know, it's not preventive measure 100%, but by using your elbow to cough is better
Then using the hand.
than using your hand,
Or
because
the handkerchief.
very good. Because the handkerchief I'm using, I'm using my two hands. That's one. So I'm infecting my hands, my body, and mistakenly I'm in home. You know, I don't hold money in exchange. But if I use my elbow, it's possible I may not hurt anybody. That's one. And my advice to my people out there, if for any reason I'm coughing and maybe I'm sneezing, I use my elbow, I will try to prevent myself from others.
Okay.
Close contact, you know, by hugging you, touching you, because once I love you, I'll try to prevent you from having what I have.
Okay. Thank you so much. Thank you so much. So now go back to Misty. Misty is how is TB diagnosed? Is there any new test for TB?
Yeah, the test that knows TB now worldwide is the gene expert test, like I was saying, because it is able to detect the microbacterium and able to detect rifampicin resistant as well. So universally, we use the gene expert test, and then we also use the AFB if the gene expert is not available, because we have been using the AFB and then the gene expert kit that is more advanced. But when it comes to follow-up cases, we use the AFB, the acid fast basket test.
Okay, so Mr. Doyen, what are the risk factors, especially when it comes to pulmonary TB?
Yeah, the risk factor for pulmonary TB, smoking is a risk factor. HIV patient also is a risk factor. Children under 5, even older people, they are at risk. Even though everybody is at risk of TB, but we have people that are higher risk of the TB. So let us know that the entire population is at risk of TB. But who are the people that have a priority? People that smoke, you are higher risk. People that have HIV, you are higher risk. Babies, they are higher risk. And other people, because as you are getting older, your resistance also, they are depleting, they are dropping. So you're also at risk of TB.
So like for other medical condition, can we say low body weight?
Yeah.
Substance abuse, substance abuse disorder.
Yeah, I don't know. Yeah. Poor nutritional status. Yeah.
Diabetes.
Yes.
Yeah,
other
right.
medical
Severe
conditions.
kidney disease.
Yeah, although you are put up to.
Okay.
Yeah.
Even the
Headache and
cancer.
cancer.
Yeah.
These are people that are at
Yes.
risk. So let us move to the prevention aspect, because time is fast spent. We're so busy. So let's start with you. How can we at least prevent tuberculosis?
Yes, we can prevent tuberculosis. Meaning when we're talking about the preventive aspect, we are looking at the pulmonary TB. So we ask patients who are diagnosed with TB to use the towel. And when you are coughing or sneezing, we say you should cover both your nose and your mouth. Wherever you go, when you are on car, when you are in the community, even when you are in close contact with anyone, try to use the towel, cover both your nose and your mouth. But if, for instance, you don't have the towel available, maybe you forgot about it, then and you feel you have the urge to cough, then you cough in your elbow, because it's hygienic. It's not hygienic to cough in your hands.
Sure.
Because you will shake anybody's hand, you will touch doors, you will touch whatever. So it will be better that you cough in your elbow this time around, because the towel is not available. We are not advising people to use handkerchief, because the handkerchief is very thin. So as you cough in the handkerchief, it will even spread on your hand. We don't want you don't want to get it on your hand. Okay. So as you cough in the towel is bigger to cover both your nose and mouth. As you cough in the towel, you close that portion of it and put it in your pocket and keep washing your hands during the day. We ask our patients to wash their hands frequently.
Okay.
Because
so
you are
it's
coughing.
also advisable for you to wear masks.
Wear masks when you go in the public
In
as well.
public, yeah.
Public area.
Okay, thank you so much. So you at the chest clinic to JFK.
Yeah.
So are patients actually corresponding to the 6-month treatment?
Actually, some are responding and some are not. Especially when it comes to the male patients. Most of the male patients, they lost the follow-up cases that we have.